This is a video on making the problem worse. The subject in this case is Springfield General Hospital. Springfield Hospital makes medication mistakes. In 2010, they found that Springfield Hospital made lots of errors with their medication. And because of this, they decided to use a system called the CPOE. The prescription errors were ongoing. The confusion over drugs with different names was ongoing. The multiple drug errors to patients with allergies were ongoing. And this increased the hospital care costs. The physician's handwriting identification was illegible. This was one of the main problems. The solution they thought back in 2010 was a new technology called computerized physician order entry. Because the system, even in place, 770,000 people were killed and harmed even after they installed the computerized physician order entry. It was supposed to be safe and accurate. The problems were with the physicians. The prescription drugs to the patients was written with their handwriting. It was illegible. So a lot of medication mistakes occurred. The nurses would use the CPOE system, and they thought they were eliminating the dosage confusion. And they thought safety and accuracy was being followed. But they failed to follow the 4 steps. 4 steps to ensure safety and accuracy were medicine and prescriptions must be logged into the hospital IT network. The CPOE entries were available to nurses and physicians, including pharmacy personnel. The CPOE was there to catch all prescription errors, including incorrect dosages to people with allergies, and excessive medication. The CPOE displayed the patient's complete medical history on the computer screen, but the nurses failed to follow the guidelines for treatment. Because of the dosages for the patients was 20 to 30 milligrams, the pharmacy only stocked 10 milligrams, and the nurses were giving 10 milligrams, which was a low dosage. If they canceled or discontinued the existing medication until the physicians double-checked the CPO system, they'd reduce hospital errors, harm to the patient, and if the staff was checked for excessive overtime, the CPOE errors would have decreased. The CPOE was there to provide medication and patient information, to reduce incorrect dosage, and patient confusion was supposed to discontinue. The steps I planned to change the process would be technical support for the hospital IT network, data entry personnel 24 hours, 7 days a week to make sure that the computer medication system was logged in properly, technical training on the guidelines for treatment. Ample evidence existed that the CPOE can and has been used to reduce both errors and costs. Commitment to change would be proper ordering new, modifying existing medication, stop incorrect dosage information, stop patient confusion, stop misinterpretation of the physician's prescription, have managers sign off on people when similar names are discovered, enlarge the fonts, order a clean workstation, and stop interruptions immediately. The end. Do you have any questions?